Good morning. Thanks for coming. This is a small presentation about a new hyaluronic acid filler from the States, from Miami, called Liquid Implant. So I'm happy to share with you some knowledge about how to choose the right filler and how to work with the right filler. So the ideal facial shape basically is balance in volume and shape, whereas the aging phase does age in all different levels, such as the skin, the redistribution and resorption of the fat pads, the weakening of facial muscles, skeletal changes, and overall a three-dimensional kind of deflation of the structures. So any aging phase does end in having fuzzy contours, concavities, shows shadows, and overexposures. So we basically aim to rebalance shape and volume with, in this case, hyaluronic acid fillers. So hyaluronic acid is a very common and forgiving substance for filler injections, as it is reversible with hyaluronidase and does show a very low hypersensitivity activity. Basically, companies do provide these fillers by changing their features, by different cross-linking processes to give the gel a certain firmness, by adding different concentrations of hyaluronic acid, and by milling the hyaluronic acid down to different particle sizes and non-particulate gel for better injectability. So this engineering makes it a bit more difficult to choose the right hyaluronic acid for the right indication, as there's so many different ones, whereas, for example, a calcium hydroxylapatite or a polycaprolactone is basically constructed in the same way. So I have the honor to present Liquid Implant today here, which is a cross-linked hyaluronic acid manufactured from non-animal medical-grade hyaluronic acid, cross-linked for sure, with always the concentration of 25 milligrams per mil, and these fine particles are blended in a uncross-linked linear HA to enhance its injection. So hyaluronic acid of Liquid Implant is a very good to inject substance with a very similar to the physiological HA having a pH and very low endotoxin levels. So the manufacturing process is basically a complex process of dissoluting the HA and then milling the gel, and then finally pack it into the glass syringes for the doctor's use. More interesting, the clinical features for us being doctors, this gel is pseudo-elastic with a good yield stress and a solid-like but very soft features under pressure. So this gel does not move having gravity on it and is very easy to inject. And secondly, the different degrees of cross-linking makes it suitable for different indications. It's biocompatible and biodegradable. So the testings and my clinical experience over many years now shows that this product, this hyaluronic acid, is biocompatible and does show a high safety profile. What are the indications we can go for with Liquid Implant? It's basically from surface to shape. You have three products for all the typical indications, such as the very fine lines and sensitive areas as the tear trough and lip for the labium, and then cutis for the more pronounced lines and folds, and the shaper and volumizer subcutis for mid-face, hands, etc. So I will show you how to use Liquid Implant for mid-face today. The indications, typical indications for the midface for me is the sagged lateral part, the sunken in frontal part, as well as the nasolabial fold. A mapping might help to find the right entry points. So the two basic first lines I do draw is the line which goes perpendicularly down from the lateral orbit, and the other line coming from the mid-mentum crossing this line is one of the injection or entry points, the cheek apex point. And here I did mark the zygomatic arch entry point, the lateral approach for the lateral lifting. So we will basically fan from this lateral point, and bolus from the cheek apex point. So the technique for the sag lateral part with liquid implant is shown here by using a blunt cannula 25 1.5 inch. The entry point is done obviously with a sharp needle. The trick is to tunnel the way with the needle, tunnel the direction you will insert the cannula later on. Then it's far easier to inject. Then to second trick, pinch this entry point and insert the cannula by using a low pressure, never force really. And this cannula is a Steriglide which has a hub marking, so we can see where the hole actually is and can point the hole down for a profound injection. So this is pinch the skin and the structures to insert the cannula softly and gently, control the tip where the tip of the cannula will end up, which is actually the frontal part of the cheek. Then turn the, in this case, the cannula down to make sure that the positioning of the liquid implant cutis is on the bone. Control again where the tip of the cannula is located and use a light pressure on the plunger and inject this volumizing and shaping product to the designated area. The technique for the sunken in frontal part actually in this case is shown by bolusing the area. So you will choose either the cheek apex point, the highest point of the cheek where it has been or will be after the treatment, has been in the youth and will be after the treatment. And secondly, you go banana-wise medial and lateral to this as the volumizing effect is desired. So this video is showing both techniques in a combination, the same patient on her right side. And this is the fanning with a 25 gauge 1.5 cannula with liquid implant cutis. I do basically 3 or 4 threads with 0.1 cc per thread depending on the needs, and I never overcorrect, I never go over the clinical endpoint. You can see how this product does a very nice shape immediately once implanted, and I simply go along the OG curve to redefine this youthful look, to erase the negative shades and to rebalance the face, in this case on the lateral, to give her back a lateral lifting. And secondly, this video will show the bolusing then from the cheek apex point. In order to save time here, I will advance the video. So this is, again, the bolusing with liquid implant cutis. Place it on the bone, gunshot-wise, look to your patient eyes and go directly on the bone. Place the material supraperostally. So showing you the last technique of this course of this session is the nasolabial fold. I start with to smooth out the alar tragus, the alar area, by doing a little puncture and giving a little bolus with aspiration first and then to this area, because that is far less painful and goes quite quick. This smooths out and gives a rebalancing action to this proximal part of the nasolabial fold, whereas in this case the liquid implant subcutis, is placed with a cannula to make the long run of the nasolabial fold looking more soft and smooth. So to insert the cannula, you go to 45 degrees, lift up the cannula a bit, and then advance, always direction medially. Never augment, think of the medial canthal line, never augment lateral to this line here. Whoops. And go fanning wise, again with a 0.1 cc of the subcutis per thread up to the clinical endpoint. So some before-after pictures showing liquid implant, subcutis, lateral lifting, frontal projection, nasolabial fold, enhancement immediately after. You can see the shining of the shade here of the light, which proves that subcutis does a very nice immediate shaping of this injected area. Okay. So in conclusion, liquid implant is might be a new hyaluronic acid filler for you from the United States, BDDE cross-linked, provided in different concentrations for different indications. And technique-wise, I always go like this. Identify the individual indication, go for the problem directly, then define the right filler features for this indication, and at the end of the day, apply this filler in a safe and please anatomically specific way. Okay. So that was one of these great products of this company. I can only tell I use various different hyaluronic acids and other biodegradable fillers in my clinic, and but this is a very good one, a very safe one, a nice one to inject patients simply like.